Partners in Recovery supports people with a severe and persistent mental illness and complex needs. So we look at things like homelessness, drug and alcohol issues, intellectual disability, physical health conditions, within the justice system as complex needs. So that requires multiple services to adequately support the person, ensure that it's a wraparound service so all their needs are met and it's done in a coordinated way. Partners in Recovery across the board have been instructed to be mavericks in this space, to be really creative, to work on partnerships so that regardless of the point of entry into the services, the person is really well supported. We just want to make sure that we can bring the attention back to the consumer, their needs. It's not about personalities or services, and try to break down the silos within the cross-sector supports that are required. It's not just mental health services that are required to support the clients. The benefit with Partners in Recovery is a well-funded program. So we are able to support this person to actually physically go and attend a drug rehabilitation centre in Wyong, for instance. This person's recent experience with flying and travel has been restraint. Restraints have always been used, so that's a very daunting prospect to get to where they need to get for the help. So we can physically send a worker with them to support them to transition to that rehabilitation centre and then to transition back out of that into the community. So having that flexibility and creativity matched with funding that allows us to meet the needs of the person regardless of what they are, and to be really open-minded and to be flexible around that. And we need to be able to make that fit for the person and provide a really high level of support and model that type of behaviour for other services. So people don't ask, why should we? It's more, why not? Why can't we do this? Why can't we do this? You know, there is no reason why we can't meet someone's needs. Anyone you talk to has had, and we've just done a local evaluation, has got great things to say about Partners in Recovery across, not just Murrumbidgee. We're really proud of what we do here, but the initiative itself has got a huge following of people who say, wow, it's actually meeting the needs. It's not ticking a box or government stuff. It's meeting the needs of the people who are really, really unwell and really don't have much faith in the service system at all, and their carers. There's a lot of tired carers out there. They, as you can imagine, really tired carers who have been doing this work. They've been coordinating the services. They've been trying to navigate this system that we as workers find really hard to navigate. You know, if we can't navigate it as professionals in this system, then how do we expect other people who are still trying to hold down a job, care for a family and care for a really unwell loved one? So it's taking that pressure off the carers, allowing them to still be carers but not the navigators of the system.